So that's me sort of in my innovation jacket, and there's me. It looks quite innovative. That's me actually in front of one of the quantum computers from IBM when I went to the IBM Think show last year, which was quite exciting. That's why I've got a big smile on my face. It looked very exotic. I quite like that. And there's me in my sort of day-to-day wear of being a surgeon, which is the majority of my working life. So there we go. So we all know about innovation. I'm the clinical lead here at Coventry. We're a big teaching hospital, over 1,250 beds, specialising in pretty much most things, especially major trauma care. So we're a level 1 major trauma centre here, and really have a good format in which innovation can grow. So we always think of innovation, it's generally somewhat, for some reason, linked to the light bulb. That appears to be the most innovative thing that mankind has created. But we all know that it's the implementation of something genuinely new. So a mobile light source has gone from a flame to a burning wire to a fluorescent chemical reaction to an LED. So even though the concept appears the same, that it is potentially mobile light source or a powered light source, the actual way it has come about has been innovative steps as we go through. So I'm going to talk a little bit about the pathway we have here in Coventry, how we can grow innovation internally, but also adopt innovation externally. And this is obviously health technology related. So I gave this presentation, or similar, I used this slide in 2019, pretty much a different world back then. Most of the things that were going to impact the world were trade tensions, financial uncertainty, climate change, etc. Most of these things have gone onto the back burner a little bit. But back then, we had Donald Trump. We've already discussed him this morning. He was still in his powerhouse position, causing some turmoil, but no more than usual. We also had Vladimir Putin in Russia, again, trying to create some imbalances where there may not need to be any. And again, from China as well, we had all of these movers in the world market. And luckily, we had Boris Johnson, who was trying to stabilize the issue. But obviously, coronavirus came along and the world has changed, and henceforth has the innovation landscape as well. So we use the double diamond approach here in Coventry, where ideally from a frontline member of staff, they will have found a challenge and have thought of an innovative strategy to try and solve that. We will then work through this process to think of any other ways we could try and solve that challenge, either through existing or non-existing means at present. We'll then try and define the actual problem and really boil it down to the exact key issue. And then we'll look at different solutions from that. And again, we'll open up all of the possible solutions that are there, and hopefully in the end, come to an innovative and transformational solution. And that's our real aim here. So at the hub, this is the hub here for those that haven't visited. We've got a whole floor, which used to be the sort of second floor of our library here in Coventry. It's been turned into our innovation hub. Also, we have transformation sitting in here as well. So it's actually the way that we can get these new ideas to the front line as soon as possible. As I was saying, we were trying to promote internal innovation from frontline members of staff. But we also try and support external innovation and adoption of existing innovations, again, through AHSN and other networks, academic, clinical, non-academic, non-clinical, industrial, with the effort in the end to try and improve our patients' lives. That's the whole point of this game. Unfortunately, innovation in the NHS is a little bit riskier than the NHS would like. I thought this was quite a nice summary of what innovation seems to show and what the NHS likes. And unfortunately, with innovation, we're trying to adopt these high-risk strategies that are likely to fail within the NHS, which is a very, very limited resource, no more so than at the moment. And some people may not be pro-innovation, even though in the end, being innovative and changing practice does improve outcomes. I think we know this. It's just trying to get it adopted and taken on by my NHS colleagues. So we look for our innovators from within the trust, and the key thing is having the passion to drive the personal innovation. And through the Innovation Hub here, we support that. We can provide advice, but it really needs people who embrace the challenges, think differently, take the risks, but key is stay passionate. Our most successful innovators are the ones that have stuck with it, driven it through, and succeeded. So we have our pathway here in Coventry, which is adopted from the Apple innovation pathway. They were very kind to come and speak to us last year about how they support innovation at Apple. And we go through a process when somebody has an idea. It can either be submitted as a Word document or a suggestion, but ideally we're trying to get people to do a little sort of 60-second elevator pitch on their mobile device, which can then be sent to us. We can then screen the ideas, and if it's potential for innovation developments, then we'll take them through our innovation clinic, which has many, many strings to it, which is the use of our IP guidance in-house, ICT support, getting end users involved, including staff and patients and public, information governance, and we also try to get our ICT team involved, especially if it's a digital innovation, because we need to make sure that we've got the infrastructure here to be able to support that. If we can then get to the prototype, we then take it to our ideas den, which previously was a twice yearly meeting. It's gone a little bit on the back burner at the moment due to COVID, but we're allowed to get our innovators up in front of the executive committee, including the chief executive, to show the ideas and get the final seal of approval from the executives. And then we're able to get the product out within the wider UHCW, but hopefully beyond into the wider NHS. And we're trying to really establish these ideas, get them into action, and try and stamp everything with a made at UHCW for our internal innovations, but also adopted at UHCW for our external innovations coming from our partners. I like to use this as an example. This is one of our successful innovators. Tessa is a senior screening administrator from the bowel screening unit, which is based at Rugby, which is our little satellite hospital just down the road. Previously, when you hit the age of 65, you were sent a little spoon in a pot to pop a little sample of feces on that, and that would be analysed for blood to see if there was any chance there could be a bowel cancer that we may be unaware of. The screening system changed in 2019 to a much smaller little device, very similar to a cotton bud, and it has to be got into a very small container as well, and it has dedicated packaging for that. And Tessa was getting calls from people who are unable to provide samples, either due to problems with visual impairments or with tremor. So she created an innovative solution to this. And it was basically creating a little jig. Because of our ongoing discussions with Real Digital, who are a company that are taking on the IP for this, I can't really show you what we've done so far, but she's created a little jig that can be used within the package to aid people with visual or mobility impairments. This has the potential for rolling out to nearly 9 million screening tests each year in the UK. So real chance to actually improve patients' lives and hopefully improve the amount of people going for their screening. So part of our innovation here is our ideas call, which is general open call to anyone that wants to throw their idea at us and see what we can do for them. We have the ideas clinic, which I've described earlier, which we can support these ideas, and then the ideas den, which is our sort of final sign off. So I think we're going to move on hopefully to Spencer. He's coming from Totem Learning. Part of my training, or part of my job as a surgeon, is to train juniors. And with my colleague Jo Skillman, in the middle at the bottom, the lady, not me, she has developed an idea in a way to try and improve way that doctors, surgeons, and potentially people outside of the medical field can be trained and actually record a record of their training. And Spencer at Totem are trying to support us with that. So I think Spencer's coming up next to talk about a different project that he's been working on, but we're hopefully producing a good partnership with Totem in able to develop our innovations internally and try and get them out there to the wider market.